Hello, and welcome to today's webinar, Navigating Medicare at 65 and Over. We're so glad you could join us as we dive into this important topic. If you're turning 65 and need medical insurance, there are some essential questions to ask to ensure you choose the right plan for your healthcare needs. Today, we are fortunate to have an expert who can help us navigate through these questions and provide clarity as you make decisions about your health coverage. I'd like to introduce Dan Weinreeb, a Buffalo native with over 15 years of experience leading strategic initiatives for national, regional, and local health insurance plans across the country and right here in Western New York. Dan's work has focused on state and federal health policies and programs, ensuring that Medicare and Medicaid beneficiaries are supported throughout their healthcare journeys, no matter their needs. We've invited Dan here today to help answer some of the most common questions people face when approaching Medicare. Thank you so much for being here, Dan.
Thank you. Thank you for having me. It's my pleasure.
Great. Well, then let's get started with the basics. What are the Medicare options for someone who is 65 or older?
Yeah, so I think this is where things get a little confusing for some people, right? They're not sure exactly what is afforded to them because they're 65, or they might have a disability that puts them at an eligibility for Medicare. So for us, it's really important to understand what's covered right away. So when you turn 65, you have access to Medicare Part A, something that you don't necessarily have to enroll in or pay extra for. You've worked hard, you qualify for it, it's yours. Then we start to get into more specifics like Medicare Part B, things that you actually have to enroll in and think more rigorously about. And then from there, you start to get into more selective insurance plans, and you might hear things like Medicare Advantage, right? A private insurance plan, and whether it's from a national company or some local company here in Buffalo, New York, that is offering those Medicare Advantage plans. So there's lots of different options, just trying to figure out what you get access to at what time and at what cost.
Dan, that's a great start. But many people want to know, is there a cost in premiums, deductibles, and copayments?
So short answer, probably. A long answer is there are definitely plans out there, especially Medicare Advantage plans, that you can get for a zero premium. Now, that doesn't mean that it's free, and you're most likely going to have to pay some out-of-pocket costs for things like doctor's visits. We all know the word copay, right? That's probably going to be something that you'll experience when you go and see specialists for certain chronic conditions and to manage certain healthcare costs. Most importantly, when you're looking to see what health plan is going to be best for you to meet your needs as well as your income, you have to figure out what those certain costs are going to be. And it's not just copays that you should worry about, right? It is the premiums. And then, of course, anything having to do with pharmacy and drug costs, which is going to be where you really start to see a lot of costs incurred.
Very, very helpful. Speaking of coverage, what does Medicare coverage when it comes to health services?
You'd be surprised what Medicare covers and what they don't cover. I think when people, when you take a look at what exactly, on a day-to-day basis, things like doctor's visits and hospital visits, ER, inpatient stays, skilled nursing facility, Medicare really does cover quite a bit of those, either in full or in part, depending on what plan you go with. What they really struggle with and what they don't really cover are some of those social care services and those social care needs, like home care, living at, what else do you need at home to stay in your home independently and as safely as possible? Things like modifications, grab bars, things like that. Medicare doesn't really cover a lot of those things. So when you're looking at what your coverage is, you have to really kind of think of what you might need socially as well as clinically.
So, for example, what are some things, like you said, the social things? Are there medical or clinical things that they wouldn't cover?
Yeah, so when you think about dental, hearing, vision. Those are all typically things that you'd have to pay extra for, right? I
Yeah,
talked to
and
my
affects 65 and older many times.
many times, and just the natural course of aging.
Yeah.
Right. I talked to my in-laws about it, and hearing aids, are they covered? Right. These are just questions that come up. So Medicare, you have to really look for a plan in addition to what is the baseline coverage for Medicare Part B, and find those that are also having those supplemental benefits like hearing, vision, dental. And then there's all kinds of other services like transportation and phlebotomy that can come into the home and do that type of service for you, right? So there's all kinds of other benefits that Medicare Advantage plans offer that pure Medicare doesn't.
Well, that leads to another very common question. Is it smart to have a Medicare supplement? I think they call it Medigap plan?
That's right. I think depending on your financial situation, that's a decision that really should be taken into account. When we're looking at resources for people over the age of 65, like AARP, right? AARP offers a Medicare supplement benefit, and they can guide you through all of that. At the same time, you do have to pay for it. So you really have to take a look at what your finances are and determine whether or not you can afford those either monthly premiums or copays that go along with having that supplemental benefit.
And with those supplemental plans, for example, the AARP, they have different plans with different costs associated, correct?
Exactly.
Depending on what they cover.
Yep. Exactly. And it all, depending on what it covers is the perfect way to put it, right? The more services and access to services and treatment that you need and want, you're going to have to pay a little bit more.
Now, what about prescription drugs? Should people consider prescription D coverage?
Yeah, so this is really where a lot of the costs come into play, right? As we get older, even people my age, we start taking medications to manage our chronic conditions and manage our health care. And unfortunately, that's something you have to pay extra for. And there's all kinds of regulatory requirements that health plans have to adhere to in order to even offer Part D prescription drug coverage. Whenever I'm talking to somebody that's over the age of 65, and my parents are included in this, I really counsel them to take a look at what medications they're taking. And that's something that you can talk to these health insurance companies about, ask them and tell them, this is what I'm taking. I'm on this for this chronic condition. I'm taking this maintenance medication, and there's all kinds of different tiers that they have for these medications and their drug plans. So you want to make sure that one, your drugs are on there, right? That they're going to be covered, and two, if they are on there, that they're within a tier that's affordable. And that's really where Part D comes into play. But you really have to ask the questions.
Now, you've mentioned Medicare Advantage and other options based on health and financial status a few times. Let's talk a bit more about these options and why people should really consider these options.
Yeah, so this is a really important one, and something I think that also hits home for a lot of people. There's a big stigma attached to Medicaid, right? Especially for people that are age 65, right? It's Medicare all the way. But there's a real opportunity, especially if your income is lower than it used to be, right? And you're living from Social Security and you might meet the criteria. Being able to leverage both Medicare and Medicaid for your health insurance is an option that I think a lot of people aren't investigating and taking advantage of as much as they should. The benefits there, especially if you have low income and you need the support, my advice is to take the support, right? Those benefits on the Medicaid side of the health insurance company and of the state are far more robust in terms of the social services, things like transportation, things like caregiver support, meals that are delivered, right? I remember having this conversation with my grandmother, and she lived to be 98 in her own home independently.
Oh, wonderful.
We were lucky to be able to have her do that, but not everybody is so lucky. And I remember talking to her about things like Meals on Wheels, and she refused.
Oh.
I don't want it. That's for somebody that can't afford it, right? And it was available to her, and she worked hard all of her life and should have taken advantage of those services. And Medicaid and Medicare combined, it's referred to as a duals special needs plan.
Okay.
And that's something that I think a lot of health insurance companies are really promoting a lot more of, because there's so many costs associated with aging, right, that are beyond the clinical and the medical. The social component is really where they're starting to see a lot of issues, and it's directly tied to health and outcomes.
The dual plans, they do a lot with the social aspects that straight Medicare would not cover. Are there other advantages to going with these plans or things that you need to consider?
Yes. One of the biggest things is access and coverage. So a Medicare Advantage plan, including a dual special needs plan that uses both Medicare and Medicaid, one of the biggest things is being able to have access to the doctors that you've always used, and even the hospitals and the facilities that either you're using today or you might have to use in the future, right? Nobody has a crystal ball. But people get sick. People have chronic conditions, and you never know exactly what's going to happen on a day-to-day basis with your health. So when you're looking for that health plan, access is really important. Access to coverage, access to the facilities that you need, and the providers that are going to help really take care of you as you age, regardless of your chronic conditions or your health status. So when you're looking at these health plans, ask them for their provider directory. If you can ask for it,
Okay.
they can hand it to you physically, piece of paper. In fact, they might even be required to do that by the government. And also, you can find them online. So when you're finding your health plan, you have to make sure that your providers, your facilities, and clinics are all in the network. Otherwise, you might be forced to go out of network and actually pay more for the services and the care that you need to really keep yourself healthy.
Oh my goodness, those are so many things to think about. What about flexibility? Can someone switch or change plans?
Yeah, this gets a little tricky, right? There's a certain window where you can buy or enroll in your Medicare Advantage plan. That window is now October through November, right? They call it open enrollment. And that's why you really start to see a lot of commercials on TV from different health insurance companies about enrolling in Medicare Advantage. That window closes. Now, what does that mean for the consumer, the person that needs the coverage? If you age in, right? So if you were 64 and you're turning 65 after open enrollment season, yes, you have that opportunity to enroll after that window. There are other things called a special election period where you might have a change in health status or a change in location, geography, wherever you are, right? You might move. Your circumstances might have changed financially. Those are all criteria that somebody can take advantage of and say, this changed in my life. It's a special election period. I need to go outside of this window, and I need to change a plan that's going to be changed to a plan that's going to be better suited for my needs.
That's good to know. Here's a big question. Should someone consider long-term care or home health care insurance?
So that's something that I know I invest in as somebody that's not 65 quite yet. I will say, it's just like insurance as a whole, right? You have to take that risk. If you have the money and you can afford to make that investment in long-term care insurance, which would ultimately most likely have a supplemental component for home health, then I would advise you take advantage of it, right? You're putting that money into that account so that when the time comes, you can actually stay in your home and you don't have to sell things off to go into an institutional setting or a facility setting. This is where you see those horror stories of people having to sell their homes and sell their assets just to be able to live in a nursing facility, right? Nobody wants to end up in a nursing home. Nobody wants to put their family in a nursing home. Sometimes it's inevitable, but at the same time, if you're able to have that long-term care insurance as well as the home health coverage, it's really going to, benefit you in the long run if you need it, right? That's always the question, if you need it.
Dan, lastly, let's talk about financial assistance and help finding the right health insurance benefits. What are Medicaid options if someone has a low income?
Yeah, so there's a lot of Medicaid options, especially in New York State, actually, right? So New York State has a very robust and rich Medicaid program. Those services that are available to those that qualify for Medicaid based on their financial status They're also available in those dual special needs plans that I was talking to you about,
Yes.
right?
Mhm.
So, although a dual special needs plan falls under this concept of Medicare Advantage, they're still leveraging all of the state services and resources that are available via Medicaid. It's really kind of like the perfect scenario, especially for people that have either lower income and also complex chronic conditions, right? It addresses the clinical piece, the medical component, the pharmacy component, and also the social services and the social care needs. So again, these are things that, you have to take a look at your finances. You have to be able to speak very openly and clearly with the person at the health plan or whoever is selling you that insurance product and really lay it out on the table for them. They're trying to make sure that you're fit into the right plan for your needs and for your status, right? So really make sure that you have all of that information available when you're making that decision, because Medicaid can really pick up a lot of services and a lot of care that Medicare Advantage might not.
That's a lot of great information, Dan, and thank you for helping us understand all the aspects that go along with choosing the right health plan.
Oh, it's my pleasure. And speaking of choosing, right? Now's the time to choose.
Yes, it is.
Right? So October 15th to December 7th, open enrollment. That's the time when you really have to figure out what plan's going to be best for you. So be prepared. Go find your representatives at your current health plan or other ones and ask the right questions.
Thank you. And thank you to our audience for joining us today. If you have any more questions, feel free to reach out to us after the webinar. Stay informed, stay healthy, and we wish you the best in your Medicare journey.